Everyone here virtually, and it's a very important month. So it is Infant Mortality Awareness Month. We are celebrating several achievements that have been made. We're going through the latest data update. So September is, along with other items, it is our month to bring special awareness. We try to do it throughout the year, but we also take this time to specifically address infant mortality. So with Preparing for a Lifetime, and this being our third quarter meeting, I want to let you know about some activities going on in that regard. So there are press releases that are going out talking about our infant mortality rate, spotlighting the Preparing for a Lifetime program and other initiatives that are going on within the state. There's also a lot of social media and promotional items that are moving forward throughout the month. Hopefully you will see those. They are spotlighting our particular 7 focus areas with PSAs, social media, digital ads, to really get the messages, those important messages, out to all. We'll also hear from our work groups in relation to what is going on in each of those areas, the specific activities, items, and focus successes and challenges that are currently being addressed in each of our 7 priority areas. Additionally, going to hear more about the maternal health hotline. That is a great accomplishment. We work closely with the maternal health, maternal mental health, and the maternal health initiatives with the Oklahoma Maternal Health Task Force and Oklahoma Perinatal Quality Improvement Collaborative. All right, so we're going to go ahead and move right on because we do have a full agenda of items. So we want to move right to our data presentation. So infant mortality in Oklahoma and what is going on in Preparing for a Lifetime, it's everyone's responsibility. I'm going to take the first few slides and then I'm going to turn it over to Benita Cunnell. She is our Administrative Program Manager, interim for the MCH assessment, and she has a lot of good information to share with you today. Next. Just to let you know, just a few of those objectives and terms we do try to go over at the beginning is to define infant mortality and what we mean when we're talking about it in this instance, a review of the rates and what makes up those rates, describing racial ethnic disparity, reviewing those top causes of infant deaths and work group measures and progress made in relation to those. Next. And these are the definitions that we're using for this presentation. So infant death is death prior to 365 days of life. Neonatal death is a death occurring at less than 28 days of life of the infant. And post-neonatal death is deaths occurring between 28 to 364 days of life. And the infant mortality rate itself is the number of infant deaths per 1,000 live births. Next. So this is the infant mortality rate in U.S. versus Oklahoma, the single rate, which we usually only publish the 3-year rate because of the volatility to really give a better overall sense. But just so you can see, there have been increases slightly in the single year rate, 6.9, and 5.5 is the last U.S. rate that we have. Next. This is the really good news is that, as you can see, if you look over the period, our items are having an effect, our initiatives, the things we're doing in Oklahoma, our public getting involved, our families getting involved, all of you and everything that you do to assist in these efforts, those rates are coming down. Since we began the Preparing for a Lifetime initiative and its precursor with the Commissioner's Action Team to reduce infant mortality, we have decreased by almost 20%. So that is really fantastic news. We're going in the right direction. We're continuing to hold on to gains that are made, and that rate is coming down. So something to celebrate. And I'm going to turn it over to Benita now, and she's going to give you an overview of what's going on state, nationally, and in specific areas within infant mortality in our state. Benita.
Good morning, everyone. I'm going to present this from the rest of the slides. So this is a slide that I downloaded from CDC's website. It shows the infant mortality rate for the year 2020. That's the latest they have. And you can see the darker shades have higher rates of infant mortality, and they are all, you can see several of them in the southern part of the United States. We have a lighter shade, which this was for 2020. And as I advance, you will see 2020 was an unusual year. So, but again, this is where we are. We were, per their rankings, for CDC's ranking, we were 33rd in 2020. Next. This is infant mortality by age of death. This is a commonly reviewed indicator looking at neonatal deaths and post-neonatal death. For the period 2019 to 2021, we had a total of 965 deaths, infant deaths, with the infant mortality rate was 6.6. And we had, out of that, 599 were neonatal and 366 were post-neonatal. And you can see the infant mortality rate for each of these periods. Next. This shows the infant mortality rate by race and Hispanic origin. We are looking at it from using the new revised enumeration of race, which came about in 2010, and that includes the multiple race. So you can see I'm looking at 3 time periods, 2019, 2020, and 2021. As you can see, 2020 was an unusual year. We had only 285 infant deaths accounted for, and probably COVID had something to do with the enumeration or lesser number of deaths. So my comparison here, where I'm comparing the actual count of infant deaths to 2019. You can see the infant death. These are actual counts. They are not infant mortality rates. So you can see the actual counts went down for almost all the races except Hispanic and the multiple races. Hispanic infant death counts went by about 35%. And the non-Hispanic Black counts went down by 32%. Next slide, please. This is the rate. We are looking at the rate, which gives us sort of stabilizes, but again, it's a single year rate just to show how it is fluctuating. As we all know, non-Hispanic Black mothers have high infant mortality rates throughout. That is, it's declining, but not at the rate of what we see with the other races. This was in 2021, the rate for African Americans or non-Hispanic Blacks was 11.8, but that is considerably lower than the previous years. In 2019, it was 15.6. So we are seeing a decline. Next slide, please. Okay, this looks at the relative disparity in terms of their population, overall population, and the overall births for these races. For non-Hispanic white race, they account for 63.8% of the population, 54.7% of the total births, and 41% of the infant deaths. Similarly, you can see for the non-Hispanic Black mothers, it's 7.8% of the total population, but almost 13% of the infant. So both non-Hispanic Black mothers and Hispanic mothers have a higher percentage of infant death compared to the total population and the births. And on the left, you see this is the infant mortality disparity ratio, Black against white and American Indian against white, and the Asian population against white and the Hispanic. You can see how the disparities have not changed very much for the African American population compared to the white population. Next. These are the top 5 rankable causes of infant death. As you will see, this list does not change very much except for the order which is it in. So most often we see the congenital malformation coming at the top. It accounts for almost 22% of our infant deaths, with a rate of 14.8 per 10,000 live births. So most of these that you see in this list are consistent over several years. I have not seen anything that is different from this coming into this list. Okay, next. This is the same top 5 rankable causes of neonatal deaths. Again, we see congenital malformation and preterm births coming at the top, accounting for almost 1 in 4 and 1 in 5, over 1 in 5 deaths for each of these groups. But I did see one that came up this year, which was the bacterial sepsis of newborns. I'd seen this way back in 2006 in one of the presentations that was done in 2016, that sepsis was at the top. So 5. So this is with the 4.7% of the infant deaths are counted by bacterial sepsis of newborns. Next slide, please. This is the top rankable cause of post-neonatal deaths. We can see some of those preventable deaths included here. Sudden infant death syndrome is always at the top, with accounting for almost 23% of infant deaths. This has consistently remained at the top for a number of years now. We have unintentional injuries and congenital malformation also at the top 3. Next slide, please. Okay, this is the top 3 rankable causes of infant death by the race and Hispanic origin. And you can see this is a little small for you to read, but again, the top 3 are the same for almost all, except for the Hispanic and non-Hispanic American Indian group. You can see the congenital malformations, preterm birth, and unintentional injuries being the same for both white and Black population, but American Indians have sudden infant sits at the top of infant death as the rankable cause of infant death. Okay, next slide, please. This is a county map of you can see where the counties where the infant mortality is higher. This is a 5-year rate that I have used, and you can see the darker shades indicates higher rates of infant mortality, and some of those are in the some of our bordering counties. Next slide, please. These are some of the indicators we track that contribute to infant mortality. One is preterm. This is one indicator that has gone up in 2021. Our rate is, this is 2021, again, is a provisional data. It's not been finalized, but again, we don't expect it to change very much. The rate is 11.9%. The yellow line shows the US average. We don't have one for 2021, but for 2020, the US average was 10.1 and we were 11.2. This is one indicator that has increased from last 2 years. Next slide, please. This is another indicator looking at low birth weight. We are sort of on par with the US rate. In 2020, we had 8.3 and the average was 8.2. However, in 2021, we have an 8.7% low birth weight. Next slide, please. This is an indicator of the healthcare access, prenatal care in the first trimester. And we can see this is an indicator that we have consistently improved over the years. And we are at 72.9% in 2021. So this is a very encouraging indicator for us that all our work is paying off. Next slide, please. These are the work group measures for the Preparing for a Lifetime initiative, and separated by race and Hispanic origin. You can see the preterm birth being higher among non-Hispanic Black mothers, and some of the other indicators are also higher among or poorer among non-Hispanic Black mothers. If you look at unintended pregnancy, they have non-Hispanic Blacks have the highest rate. Okay, one of our other encouraging indicators is teen birth rate. It has dropped so much. We are at 9.1, I believe, for 2021, and we can see it's dropped considerably for all races, with Hispanics having the highest at 16.1 per 1,000 females in that age group. Smoking has also dropped. Okay, sorry. Kamisha, can you go to the other slide, please? That's the first one that we should see. Next, please. Okay. This is the first slide, and the other one should follow. This is the overall. You can see unintended pregnancy at baseline 2012 was 36.3 compared to 30.6. We have done wonderful work in decreasing the unintended pregnancy. We have a 15.7% change between 2012 and 2019. We don't have data more current than 2019 for France. First trimester PNC is, as I said, this is another indicator that has improved. We are at 72.9%. Compared to 67.2% in 2009. You can see, as I said, teen birth rates have dropped by 69% when considering to 2009 rate of 29.4. That's like amazing. Our only rate that went up is preterm birth. And postpartum depression is the other one that has seen some tremendous progress, from 33.3% in 2010 to 54% in 2018 to 19. Okay, next slide, which I was talking about, Kamisha, go to the Hispanic, the race and work group measures, please. Yeah, this one. Thank you. So you can see, there's what I wanted to point out some of those indicators. One is the smoking back. So infants put to sleep on their backs. That is one indicator that we have seen improvement over the years, but it remains low for non-Hispanic Black mothers. They have always remained in the 60s, so that's somewhere probably we have potential for improvement. Postpartum depression screening too is an indicator which is low among the Black population. So this is a slide that I think it gives us a lot of information for where our programs can be targeted. So I hope this information has been useful to you. And if you have any questions, feel free to contact any of us, or we'll be happy to help you.
Thank you, Benita. That was a very good presentation. We appreciate you sharing this information with us. Does anybody have any questions, comments? Becky has her hand raised. Becky?
Yeah, thanks for that, Benitha. I'm always look forward, to getting, this updated information every year. I certainly, use key pieces of this in, the work that I do. So very much appreciate it. No, I put in the chat box, but kind of about in the middle of your presentation when you were going through the different causes of infant mortality, was it SIDS, congenital, and breaking it down by percentage. But then you had maybe 5 or 6, there were a couple of slides there, but they didn't add up to 100%, unless my quick math. So go to the ones after that where you had, like that one, for example. So it says percent of infant deaths, but your totals over there don't add up to 100%. So was it
Just top 5.
something left out, or?
This is just top 5 causes.
Okay. So, I missed that part. Okay, that explains it.
Any other questions, comments?
I just say I don't see any hands raised. There's a lot of comments for great information. Thank you.
All right, well, very good. Oh,
Becky, is there another hand?
No, just thinking too, in looking at the changes in different, rates now that you've got some 2021 data. It's certainly going to be interesting to see, as we maybe kind of drill down, the impact that COVID had on, preterm delivery, very low birth weight delivery, some of the indicators so we're starting to see some of that impact.
yes, we are, and we hope to be able to share more as we learn more in that regard. We've been working with CDC on analyzing some of that data and looking at that data, not just for our state, but across the nation. There's definitely some impacts, but still trying to get to what those impacts are exactly consistently are. But thank you, Becky. Any other questions? You guys are much quieter than usual. All right. Well, like I said, we do have good news to share, and we're happy about the overall trending downward for infant mortality. There's always a few concerns, and the preterm rate is one I know we're working on to dig into further, both in our state and across the nation, as that rate seems to, after a decline for several years, has now the last several years been inching its way upward. And we want to address that and hopefully be able to turn that around. Okay, I think next, Kamisha, were you going to discuss the maternal mental health hotline?
Yes, good morning to you all, and thank you for taking time out this morning to be on the call today in the meeting. Just want to make sure that everyone is aware. I know there's been a lot of information that's been shared via social media within different groups that you all may have been a part of. But I just wanted to bring to your attention that we do have a new National Maternal Mental Health Hotline. I sent out through the group before in the stakeholders email listserv, and I'll do it again, about a webinar talking more about the new maternal mental health hotline from HRSA and why they set it up and all of the things that goes along with that. So I'll definitely make sure I'll send that out again if you missed it in the email. But if you, and I'll drop this link in the chat, but if you go to the National Maternal Mental Health Hotline, you'll see this is the homepage that's provided by MHB. It's 24 hours a day, 7 days a week that moms can reach out to receive mental health services. They do have the 988 suicide and crisis line, a link to that as well. So it talks a little bit more about the resources. It has frequently asked questions. There is also some promotional materials for you all to share on your social medias, in addition to pass out in your clinical setting. So everything is here for you. So there's nothing that you have to make up. I also wanted to put out there that there is some frequently asked questions. So if you plan on sharing this with your clinical staff or your partners, it has some frequently asked questions as far as who will be on the other line as far as facilitating the conversations and helping that mom, and what other languages that's available. So as you can see, they have different various languages that is available. So again, this is just a brief introduction of the national hotline. You all probably heard it before, but I just wanted to make sure you have the resources just in case you missed it. And I'll definitely send out the link to this website. It looks like James also put out PSI in the group, so you'll have that too as well. And I'll send out the webinar talking more specifically about this hotline from HRSA itself. And that's all I have. Just wanted to make sure we talked about that. So we're excited that this is an opportunity for our families when we're talking about maternal mental health. James, is there anything else that you would like to add?
No, I just think I wanted to put in about the support groups because they're, as the operator of the hotline, they do a great job of having that available 24/7. It's operated by professionals. So it's not peer led. These are professional therapists on the line 24/7 available for anyone who needs that support. And the support groups are also available. And I'm always impressed with the amount of groups that they add all the time. There were just this month, there was some more Spanish language groups added. So we have, well, I was about to make a comment that I'm going to save for my talk about our work group because it's going to spoil it. I'll be quiet about that for now.
All right. I showed the website as far as the postpartum.net that he had dropped in a link. Again, you'll definitely have a list of these resources post the meeting. So just want to make sure that we capture everything. So the more that we're aware, the more that we can share with our partners and put this into practice. That's all I have.
Also in the chat, it says from Brittany, I haven't looked yet, but are there any materials that are geared toward teen mothers that you're aware of?
So
Hey.
Brittany, if you're talking about, oh, sorry, Kamisha, I didn't mean to cut you.
No, that was me. I was saying I just asked that because like the images that I've seen, they look more like adult mothers. And so I was just wondering if you knew if there were any other ones that have like the HRSA logo and stuff that have teen mothers.
I haven't seen any, but I'll do some digging, see what I can find.
Okay, yeah, and I didn't look yet, so I can also look and maybe that's, I don't know if that's something that I could work on and do, but it'd be great to have that because I feel like if they saw this, they would think that it's just for like an older group and not for them as well.
That's a good point, Brittany, and something we'll look into further, see what we can do in that regard. Thank you for bringing that forward.
Yeah, thank you.
And Joni also says the SAMHSA website has a number of publications additionally. So there are many resources right now. It's a hot topic both in our state and nationally. So please take advantage of those resources that we have. The free resources, they're available to everyone in need. So we really want to get that message out. So that is taken advantage of. Anything else you want to add, Kamisha or James?
That's all I have, but I'll save everything else for James and his work group.
Sounds good. Well, that's perfect segue. We will move into those next because I know our work groups have a lot of great news to share today. So we will start. Yes.
Joyce, this is Shelley. I'm so sorry. I got pulled away a few minutes ago.
No problem.
Question and answer. And I apologize if you guys talked about this. I I was wondering, and great job, Benita. That was really great information. I was just wondering about that prematurity rate going up. With all of the other one, like smoking going down and everything. Do we have any indication, or is there any more information on that about why we think that it's going that way?
Go ahead, Benita. Were you going to speak?
Sure, I mean, thank you for, we did look at what was going on because as I said, 2020 was an unusual year. We did not see, but in 2021, we see that very preterm, that is the 20 to 28 weeks have gone up considerably. And it has something to do with COVID. I've not had a discussion with Jill about it, but I did mention to her that this is concerning. It's that gestational age that is 20 to 28 weeks, which rarely do you see very much changes, but that has gone up. So probably studying, I mean, I heard we need to study the impact of COVID, and this is probably looking at the individual gestational ages and looking at preterm probably is one of the projects that we need to take up.
Yes. And I know it's also been referenced that more babies are being saved. They're living, they're taking that first breath and are living longer with the technologically items that have been done medically. So I think that comes into play where more of those are actually being born and surviving at least the first few days of life, along with what Benita's referenced. But we are looking into it further and trying to dig into that, put a special effort into it. And I know nationally they're also trying to look into it, as well as I know March of Dimes and others too, really trying to further determine what is that cause and what can we do to turn that around. And I think Kelly's got, could the preterm birth rate be affected during this time due to the tremendous stress levels that we have all experienced throughout the pandemic? I would say that's possible. Again, we'll need to look into those further. I think we're going to learn a lot over these basically 2 years of pandemic, over 2 years that was experienced. I think it will have an effect, some direct and some indirect in relation to that time period. But more to come in that regard. We don't have those specifics at this time other than what's being looked at and what's being further looked into. Like I said, there are differences and those are being looked into as how they can be linked.
Well, I thought it was tremendously exciting to see all the progress since 2012. Everybody has worked so hard on this effort, and you guys are really to be commended because I think it's really wonderful. The other one that stood out to me was the Native American, the difference there with the causes of was it the infant death? Overall, that it was really related to that there might be some opportunities with, was it safe sleep or I don't know. Well, it's just that SIDS is really the standout there, right?
Yes. And I think there's something that further that can be done there in that regard. But this is the first time I recall that it's been a top cause of death for any race or ethnicity as far as the #1 cause for any race or ethnicity.
That's interesting.
Thank you, Shelley, for those questions. Benita, did you have something you wanted to add?
I mean, I agree with Shelley about that the American Indian population. This is the first time I'm seeing that because that's a preventable death. And so I've never seen it at the top of the list, but it is at the top now.
All right, we've got some more to look into further and see what we can find out and improve, hopefully, as we've tried to do with other items. So, and speaking of that, we will move into our work groups and hear more about what's going on in those top focus areas. So we have maternal mood disorders first. James, you going to talk to us about that?
Certainly can. Okay, Kamisha, can we go to the next slide? So we do have, I'm really excited, the first time in person, we did this last year, but of course, COVID transitioned everything virtually. This is the first in-person time we're going to have the PSI, Postpartum Support International certification training here in Oklahoma in at least the 5 years that I've been here. And so it's very exciting. Those are both flyers on this page for that training. One of the other things that you'll see highlighted on the slides here is that we now have an Oklahoma specific chapter for PSI. Now, why that matters, that we have an active chapter again, is that when, as I said earlier, they provide a lot of online support, but they also have any of the national efforts when it comes to fundraising, when it comes to the money that they raise, that funnel into local chapters are then passed on to local efforts. So that includes education, that includes, and when I say education, primarily it's education of other mental health professionals, like the training that's on the screen. And then in addition to that, and I think probably most importantly, they have a specific fund that goes into basically grants, or I don't know another word you would use for that, but essentially it's a pool of money for treatment, for therapy, for women and men impacted by perinatal mood and anxiety disorders. So that's one of those things that we really needed to have these positions filled in order to funnel that money locally. So I'm really excited to say that now we have a chair, we have a secretary, and all those positions are filled beyond, I think the treasurer position is still vacant. So that's very exciting, because it's been at least a year and a half, if not 2 full years before that, since that's been the case. So some great news. Okay, so here's the next point about the trainings. These are going to take place October 12th through the 14th here in Oklahoma. We have all those who are essentially going to attend the training. I've sent and vetted applications that have come in. I've sent those on and vetted those for updated licensure. So we have 40 scholarships. Those folks have already been looked at. We had over 80 applicants, so that's the really awesome news. Huge amount of response for this training. And the folks that I passed on for approval, all, my priorities were folks who had long-term experience in the field and folks who were in more rural areas. So we've got people in all corners of the state, which I'm really excited about, because I think one of the things that for those of you who may not be familiar, we partnered with OPQIC and provided them the names for a map, for one of their maps. They have a lot of great maps on who is actually trained on PMADS here in the state of Oklahoma. And as of now, we've got some folks here in Oklahoma City, we've got some folks in Tulsa, but more rural areas we don't have quite as many people. So I'm really excited to see that a lot more providers who applied were in more rural areas. So we've got that deadline is passed. But if anyone who's out there would like to register and attend the training, they can. We just don't have any more slots for a scholarship, and that's open through October 3rd. Link is on the very bottom of that slide. Okay, well, let's go to the next slide. So for anyone who's not aware, we did have the Oklahoma City Climb Out of the Darkness fundraising event. This is an awareness event. That's why I promoted it as awareness, not for the fundraising piece. Specifically around, again, maternal mental health. This was the 3rd year that this has been held here in Oklahoma City, and the chair of that event is Emily Clark. You can see her in the picture. I think it's the 2nd picture down. This year we did it at the Lake Hefner Park, and it's the lighthouse the whole theme for the event is Climb Out of the Darkness. So the lighthouse is a very symbolic place that we wanted to meet and have the event at. So 60 people attended this year. It was super, super hot. So honestly, I think that's a great number. With everything going on that weekend, there was a lot of other events. I think that was a great turnout. And again, as I mentioned earlier, that money that's raised, the $3,800, will hopefully be funneled back here in Oklahoma. So pretty exciting. Over $300,000 nationally was raised. Pretty cool. Again, that goes to support the support groups. That goes to support the free chat lines and scholarships for therapists to attend the training, certification training I mentioned. The other big news this year is that this was the first year ever that Tulsa has had a climb. So pretty awesome. If you remember from the previous slide, Leah Meyer, who's actually the leader of that climb, raised almost $1,000 there in Tulsa. So I think they're going to have theirs in October and the following year. And we're looking for anyone who's interested. I help however I can, Emily, organize this year. So if anyone is interested either here in Oklahoma City or if you're in the Tulsa area and you want to help out with the Tulsa climb, Leah's information, her email is on the slide as well. Okay, let's go on to the next slide. Okay, so I'm going to switch hats and talk about infant safe sleep. We've got some equally exciting news to share in this work group. Ooh, I messed up my transitions there. I don't know why all the stuff popped up at the bottom first. So for anyone who doesn't know this, some of the folks on this call I know have heard me say this before, so I apologize if it's repetition, but we did have, for the first time in 6 years, new AAP guidelines released back in June. And this is the first time in 6 years. So 2016 was the last update. I would say primarily the biggest differences between then and now are clarifications, not huge ground shifting differences, but really more clarification in what those positions are. So as an example, it's 22 pages. We can't go through the whole list here, but I wanted to give you guys a sense of what that means. So 2016, their recommendation around tummy time was that supervised awake tummy time was recommended to facilitate development and minimize positional plagiocephaly. So the difference here, of course, is that not only have they said that, they've added the component where they actually clarify, hey, let's do this for short periods of time, right after discharge, increasing to at least 15 minutes to 30 by 7 weeks. So it's not a change in the sense that the recommendation to do this is the same, but it's how we do it, right? So that's more clarification in the information. So the biggest new thing I would say in these recommendations are the recommendations around weighted products. I'm really glad to see this. I've had quite a few questions around this in the last 3 or 4 years as these have been more and more common. So you may have seen, I certainly have, a lot more weighted sleep sacks, weighted sleepers. I've seen a lot of those. And we now have clear guidance that these are not to be used. Basically, any weighted sleep product, blanket, swaddle, sleep sack, do not use it. That's the recommendation from the AAP. If you'd like to dig in further to the guidelines, there's actually a link at the bottom of this slide to the full guidelines. I believe I also sent the PDF of the journal to Kamisha, so I think that'll be provided as well. Next slide. So this is really exciting news. I know that Alicia Lincoln and I have both talked about this from time to time. We wanted to put together some integrated information on safe sleep in the period of purple crying. We now have those products available, digitally at least. We don't have them printed yet, but we're working on that part. So there's 2 formats. There's a poster on the right side of the screen, and then on the left side is a front and back rack card. So it's about, 8 inches long, about 3.5, 4 inches wide, front and back. And we've integrated both those messages along with some tips on just helping your child sleep in general. So we talk about, obviously, that the period of purple crying is normal. We talk about our safe sleep guidelines. And in addition to that, there's information on making sure that you have a support system, making sure that you can call those folks when you need support. Information on setting, putting your child to bed at the same time, setting routines. I think it turned out really well. Please do get with me or Alicia if you'd like a digital copy. I don't have them printed yet, but we're working on that. Next slide. Okay, I wanted to make sure to hit on this because it's a pretty hot topic. There has been a lot of new news articles in the last two and a half weeks, I think, is where I really saw these come out on this enzyme that I'm not even going to try to pronounce. You can see it on the screen. And it's called a SIDS cause. We've identified SIDS in terms of the cause for SIDS, not the case. So essentially, what this study has done is looked at levels of this enzyme in infants who they have a control, and then they have infants who have passed away, and the infants that have been identified as having died from SIDS in that group, they had elevated levels of this enzyme. Now, the catch to that, of course, is that these samples were more than 2 years old, and sample size is fairly small. Only one study, right? So what do we know about only having one study? We need to replicate that. And what I think is most informative is what Dr. Rachel Moon has said. For anyone who's not familiar with her, she is the chair of the AAP Task Force on SIDS. And I'm just going to read her quote because I think it's pretty informative here. She says, the differences of blood levels were statistically different. Even if this is confirmed by larger studies, there's not enough overlap between cases and controls. It could be used as a blood test with any reasonable predictive value. So what I interpret from that comment is, even if we see this replicated, this enzyme is not going to be predictive enough to tell us much. So for now, we shouldn't jump up and get on tables and say we have a cause for SIDS, because we don't. And I think that may be it for me. Thank you. Any questions?
Any questions for James?
This is Benita. I have just a quick question. How can we address SIDS and safe sleep with the American Indian population?
I think that the primary thing, and I said this before, I just don't know that we've done all that we can to do this, but is to look at what's the information that's being received from elders that's passed on to new parents. So, one thing that we know about all parents is that they very much listen to and appreciate the input from their parents, from their grandparents. And it's even more so the case in the Native community. Elders and their wisdom is given much weight. And so if you have practices that are continued from generation to generation, that's going to be a tough battle for a governmental organization to combat. So I think going to those folks and making sure that the grandparents are educated about the new information is critical. That they are then going to pass on that updated information to their grandchildren and their adult parents.
Very good. And I think in the chat, there's also some items going on about looking at smoking habits in the population as well, which I think is very good and look into further. And also references grandparents raising grandchildren and messaging in regard to that. So
I would agree with both.
Very good comment. Yes. Thank you so much, James, for providing this great information and making it available. Any other questions, comments? Okay. We'll move forward to infant injury prevention now. Alicia, Lisa, Brandy. The floor is yours.
It's Alicia today.
Alicia.
We got the B team. So, can we advance the slide? Yeah, there we go. All right. So the comments about grandparents are very timely. It's almost as if we asked Cassandra to put that in the chat. Because one of the projects that the injury prevention work group is collaborating with multiple partners on is a grandparenting toolkit. I'm skipping down here, but to kind of provide grandparents with information and up-to-date facts based on their needs. So are they occasional part-time or full-time caregivers? And we're working with OCCY, we're working with Sunbeam, we've got some folks from DHS, various county health departments, as well as our work group members. So if that's something you're interested in, send me an email and we'll be happy to add you to the team. The work group, the injury prevention work group as a whole met in July, and OCCY summer intern Max Smith gave us his safe sleep environmental scan. And also we worked on finalizing the orders this summer for the Period of Purple crying material for our 39 participating hospitals, and all of our outstanding MOUs were returned to us. And also OCCY purchased some dad materials to assist new dads in learning about those norms of infant crying and some coping mechanisms. Our longtime committee member and Period of Purple crying champion, Barbara Coop, retired from OPQI. So we'll miss her, but we're happy for her in this transition. We did develop that brief that James showed. So I don't have pictures. I was glad he did. Thank you, James, for sharing those. And the importance there was something that was brief, that could be sort of consumed quickly and had pictures and kind of simpler language. A lot of times we get stuck in a pattern of talking about safe sleep environments. Well, as a new mom, that might not mean very much to me. We did work with Cox Media to create a PSA for drowning prevention for both infants and older children, and that ran on streaming media in the summer. And also we had some ads that we had created last year that ran on Facebook and other web applications. We did I think it was last week, might have been the week before, participated in the Oklahoma City Firemen's 5K, some of us in the work group, and that raises money for smoke detectors for families in need. Let's see, Cassandra, I see your question in the chat. If you reach out to Lisa Rhodes at OCCY, if you don't have her information, I'll get it to you. And she should be able, I think he's developing a document that can be shared. I know he has a presentation. And then, yes, so the toolkit, and then working on, oh, that seems like yeah. So, and then of course the materials for fathers and Hispanic families that were delivered to the hospital. So I think that's about it. It's been a busy quarter for us, and we're super excited, and hopefully we'll have more information at the next meeting on the parenting toolkit that we can provide.
Thank you, Alicia. Any questions for Alicia or the infant injury prevention work group? Okay. The next we have interconception, preconception. And just letting everyone know, our leader of this group had to step away. She had an urgent matter that came up. And so she has provided this slide. And so I'm just going to quickly hit those items in that regard. So Medicaid expansion is something that this work group is following closely, and how it may increase coverage and access and utilization of preventive health services, which is believed that it will. So we're continuing to watch that closely, as that has grown tremendously, those that have the ability to access those services. Focus forward trainings with the Nexplanon training for new staff was held in August. So that is continuing with that important effort. Also with LARC, they're exploring options for collaboration on a health services initiative project with CHIP funds and community partners. Continuing. Cox Media messages are out there, all part of the infant mortality kind of media splash and items that are going on as an important focus area for preconception, COVID and pregnancy, and also maternal mortality related. And we are getting a very good response in relation to those ads that have been going out, and they are digital ads. Title X services have been resuming slowly back to pre-COVID levels, which is great. All services took a decline during the COVID surges, but we're seeing those return to prior levels. Fatherhood projects continue. Also the STAR Clinic, which is a substance use treatment and referral clinic for pregnant women with substance use disorders. That continues to grow and expand access to maternal fetal medicine telehealth visits and assistance in being treated for those disorders. The maternal fetal medicine clinic continues with Cherokee Nation, along with the travel vouchers and car seats as part of that program as incentives. Southern Plains Tribal Health Board, messaging on STIs and pregnancy, congenital syphilis, gestational diabetes, working on those co-efforts together. Prenatal care continues in the county health departments and is expanding across the state. Chest Health is also expanding across the state to contractors for that electronic app for that warm handoff and referral for treatment for substance use disorders. And as does the health equity and implicit bias training continues. It is available on e-modules now, the Speak Up. If you are interested, have groups that are interested, please get with Kamisha and she can get you set up in that regard. Those training is free and available to all who are working in the maternal and infant areas. I think that pretty much concludes. They're also continuing to expand the webpage with evidence-based information for pregnancy and interconception care, growing that to be a true resource and effort for women and providers looking for more information. And also the rise in syphilis that has caused some great concern, particularly congenital syphilis, looking for ways to further get those messages out, information, and how to identify the causes to get early treatment is moving forward. And that is what they had to report for this quarter. I don't know if there are any questions. All right, well, we will move on to the next group, and that's the tobacco use work group. And I think, Angelina, are you presenting for tobacco?
I think Angelina may have had to step out. I'm Leslie Dehart. I am the lead tobacco control coordinator, and I am at a serious disadvantage because I am filling in for Crystal, who will typically be with you guys, but she's out on maternity leave right now. When I talked with Angelina, the update that she had for me was about the tobacco quit line use numbers. And so we have the July report. In July, there were 17 callers who identified as being pregnant at the time, which is down just a little bit from 20 previous month. That's the only update that they've given me. But as we talked about earlier, whenever some of the other groups were presenting and when we had the data this morning, we can definitely go back and take a look at some educational pieces for the Native American population with smoking and any kind of interaction with that SIDS outcome. We can definitely, Shelly and I have already been chatting. We can take a look at that and maybe work on some resources for that population as well.
Wonderful. We'd love to do that. Thank you very much. Okay, and I think next we have prematurity. And I believe, Erin, you're going to be presenting on prematurity update.
Yes, and I apologize, I don't have any slides, but we don't have that much to report back. We are doing the low-dose aspirin campaign. We're currently developing materials for providers as well as patient education for pregnant women. And we're really working on determining the best way to get providers on board because we've seen that as an issue. We're also looking into how we can have low-dose aspirin available for women at prenatal visits in the doctor's office. So really just figuring out logistics of all of that, but that's really all I had.
All right, thank you,
Thank you.
Erin. Any questions for Erin? All right, Becky, did you have a
Yes,
question?
I had a question.
No,
Go
I've got-
ahead.
I wanted to know, were there any current brochures?
Any
Or
current
education in it.
brochures?
Yes,
On-
and prematurity as far as regarding smoking. Does she have any current brochures? I heard her say they're working on some. Are there any current ones available?
For
Erin, for
smoking,
March of Dimes.
I can look and I can send it to you, Yolanda.
Yes.
You're looking for smoking, you said?
Yes, smoking and how it affects as far as prematurity, births.
Okay, sure. Okay, yeah, I'll get you that.
Thank you.
You're welcome.
Great, thank you. And Erin, if you want to send, we can send it out to the whole group also.
Okay, yeah, I'll get it to Kamisha.
Thank you. All right, and then wrapping us up for our work group updates is the breastfeeding work group. And we have Nancy, Adriana, and Becky, and it looks like Becky is going to be starting that discussion. So please go ahead, Becky.
All right. Well, I don't have a slide to kick this off, but I want to make sure that everyone in this group, and some of you I know are aware that Nancy Bacon is retiring at the end of this month. So this will be her last Preparing for a Lifetime meeting. And goodness, I've worked with Nancy for over 20 years and I'm going to miss her. And she's been a great, great partner in all the work that we do. So, anyone in this group, I know Heidi with COBA is in the meeting today, and we are hosting, a little going away retirement luncheon for her on September 20th. So, if anyone, wants to join us at that, we can get that information to you. So, anyway, all right, so let's talk about breastfeeding. So I have the kind of first set of slides. So we have August, of course, is National Breastfeeding Month, World Breastfeeding Week's in there, and lots of data comes out from the CDC. We've had just a lot of new publications, so it's been a busy and exciting time. And so you can see here the CDC released their 2022 breastfeeding report card, and they publish this every 2 years. And so one of the kind of key graphs here to show is just, we still have around, 83, 84, sometimes 85% initiation rates nationwide. But then, of course, you see the gap there of, barely 25% of babies that are meeting that target of exclusive breastfeeding at 6 months. So definitely a lot of work to do there still, but at least seeing, things going the right direction. And a couple of new indicators, they always kind of do something a little different or highlight some new indicator every time they put the report card out. And so this time they had, they listed all the states in any work that a state was doing on paid family and medical leave. So that was an interesting chart to see. And then also a new one on early care and education licensing and kind of a breastfeeding support score. So I'll get to that here on another slide. So Kamisha, if you want to advance to the next slide. So here you can see, once again, the breastfeeding rates come out every year from the CDC in August, and then of course they time it so they can include those in the breastfeeding report card as well. But now, as Joyce was putting the somewhat positive spin, or talking about the infant mortality rates, you know, fluctuating quite a bit. So we see that with the breastfeeding rates too. And so one thing to highlight here is, because I report on this every year and track how we rank. And if the ranking is listed in red, that means, you know, that our ranking fell, because last year, you know, we had really gone up in all categories. So the frustrating thing, this is pre-pandemic, and actually the rates even nationwide were pretty stagnant, which was a bit surprising. And we actually saw the national averages decline for breastfeeding, you know, the ever breastfed, and then exclusive at 3 and 6 months. And then in Oklahoma, you know, we declined a bit, or a fair amount, in all categories. Now, this is a fairly small sample size. So to put it in perspective, the data that we get from PRAMS that you saw from Benitha earlier, our breastfeeding initiation rates were, you know, somewhere in the 80%, 82 to 87%, which is definitely more reflective of what's going on. But this was based on babies born in 2019, and that's about 250 families or breastfeeding parents that respond, that they have data from. So absolutely, from year to year, we can see some big fluctuations. So next slide, please there, Kamisha. And so this was the graphic on the early care and education. And so the states indicated by kind of that light beigey color just shows that they're, you know, child care licensing doesn't address anything or say anything about breastfeeding. So we're in the middle category. There's actually 3 indicators that they score on, and I think we meet 2 of those 3. So we couldn't say 100%, but we weren't 0 either. So anyway, that's kind of how we compare to the other states on child care licensing related to breastfeeding support. Next slide, Kamisha. Thank you. And then looking at, before I mentioned that too, just one other report that came out that is mentioned on the handout that we put together that you'll get by email. The American Academy of Pediatrics at long last released their updated breastfeeding policy statement. And that's been a 10-year gap since the last one came out. So of course, COVID delayed and other things, but we were very excited, and no major changes in that, other than that the AAP recommended, of course, exclusive breastfeeding for 6 months, and then continued breastfeeding to 2 years or beyond. So they're now aligned with what the World Health Organization has been saying for some time. So that was, you know, really a significant change. And of course, no surprise, they got some pushback on that because a lot of people said, hey, you know, we're struggling to get to 6 months, and now you just moved the bar to 2 years. What, are you crazy? And one of the reasons, well, of course, the evidence supports that. So that's one. But the other reason they gave for now making that change is looking at it from a policy perspective, and that a lot of the policies and laws and things may say, for example, supporting breastfeeding in the workplace ended a year. So if someone actually is breastfeeding past a year, they lose a lot of the protection. So they put that in there, not only based on the evidence, but also to promote, you know, some additional policy changes. Anyway, becoming baby friendly in Oklahoma, you can just see how we're doing here. We have 11 hospitals and that are currently designated, and several have been redesignated. They get redesignated every 5 years. Cherokee Nation just got redesignated this year, and then Chickasaw Nation is actually having their on-site redesignation visit this fall, and that will be our first hospital post-pandemic to have an on-site visit. So we're excited about that. And just now, really making a more active step to recruit new hospitals, because it was just a big ask during the pandemic to try to ask them to take that on. So anyway, so next slide there. Of course, you can read in our handout about our breastfeeding hotline and, you know, some updates on that. We have developed a new in-person one-day training for NICU staff. This has been requested off and on for some time. So we had time, earlier this year to put this together. It's actually been piloted at Norman, and we'll be doing this for Mercy sometime this fall. So this is certainly, another option that hospitals can, you know, request. We call it, you know, one of our on-demand offerings, so that I can, you know, go there on site, and it makes it easier for them to send their staff. All right, next slide, Kamisha, thank you. So when we look at, COBA's been busy. I know Heidi's on today too, and she's been really busy. But this was a really exciting development here. We had an interim study that Senator Hicks, and that's Joanna Dossett there in the picture on the left with in the middle with Heidi on the left and me on the right. And we did an interim study at the legislature last fall, and went from interim study to the Department of Corrections, you know, telling us this year, okay, what do we need to do to make this happen? So we didn't have to pass a law to make this happen. And so everyone's very excited about it. We just had a visit out to Mabel Bassett, and are working with the Department of Corrections to develop a program so that any incarcerated pregnant mothers, you know, have the education and support they need to, you know, provide milk, to be pumping and providing milk. And we'll partner with the Oklahoma Mothers Milk Bank to get that milk to their babies. So next slide, please. And in our handout, you'll see other updates from COBA that you can certainly take a look at. And then our Oklahoma Mothers Milk Bank is busy with lots of hospitals requesting donor milk, and of course our Medicaid coverage that will be coming by the end of this year. So we are very excited, but we definitely need help in just continuing to recruit breastfeeding parents who want to donate milk and to get screened. Another publication that came out recently from the CDC that y'all may see some media headlines about, it was one of the MMWR reports from the CDC that they put. They actually, and we knew they were doing this. They've been communicating with us all along, but they went back to the last 2020 MPINK survey, where they're now asking questions about use of donor milk in the NICU in the hospital. So they actually released an analysis of the percent of NICUs around the country that are providing donor milk, and their goal was to highlight the fact that we're not at 100%. Now it's not as high as I thought it might have been. We still have about 17–18% of NICUs that are not providing donor milk, and then they broke it down by different hospital type and so forth, for-profit, nonprofit, baby friendly, not baby friendly, and so forth. So it was a very interesting report, but a lot of the media headlines came out saying, shortage of donor milk in the NICU. And that made it sound like they couldn't get donor milk from the milk banks, when that was actually not what the CDC was reporting. They were reporting the fact that we still have a significant number of hospitals that will not provide donor milk in their NICUs. So that was the point of that. Just be aware of that if you see anything about that. So anyway, if you know of anyone who might be interested in donating milk, have them go to okmilkbank.org and or call the milk bank. And I think with that, I'm going to hand it over to, see if I missed anything. Nancy, I'll hand it over to you. Oh, yep. Well, here, Nancy, I'll let you handle that one. Is she there?
Yeah, I'm there. Sorry, I couldn't get the camera on. Anyway, as you all know, or probably know, August was Oklahoma was World Breastfeeding Week and National Breastfeeding Month, and we have to give many thanks to COBA and Heidi Russell, because there was a proclamation that was developed and presented. And so actually, August is proclaimed Oklahoma Breastfeeding Month. So Becky, you want to read that? I can't even read it. Or can you read it?
Oh, no, I would say it's too much to read. Just that I think if we asked, I know what we've actually tried for several years to get a state proclamation signed by the governor, and Heidi was the first one to actually get that accomplished. So there she is in front of the governor's door holding the signed proclamation. So we're very excited about that.
Yes, many thanks to Heidi and Koba. And I guess we could go to the next slide, please. So I just wanted to share some of the many activities that were going on during the month of August. And these are just a few. WIC shared, they always share information in their What's Up with WIC video conference, and shared all kinds of activities for ideas for activities, and the certificates that are given to the breastfeeding moms, and the World Breastfeeding Week information, and their competition. And normally Adriana would be here, but she is at in Orlando at a breastfeeding conference, the National WIC Association Nutrition and Breastfeeding Conference. So that's going on this week. And then Tulsa shared a WIC peer counselors video, and the link is in the handout. So be sure and check that out, because they did a really nice job, Tulsa Health Department, and it's on their channel on YouTube. And then WIC also received a peer counseling breastfeeding award of excellence. Cleveland County and Creek County Health Departments received that in August. And then Becky's group did a wonderful workshop, breastfeeding and pumping workshop with the OU Health Sciences staff, Live Well. And so that's also recorded and for you here. So be sure and check that one out. Great information. Becky and Jacqueline did that presentation. Then COBA created or developed National Breastfeeding Month conversation series, and there are actually weekly videos that were the videos were oh, I'm lacking the word, sorry, were shared or coordinated by Quinn Tran, who was a former Channel 4 news anchor, and she's also a breastfeeding mother and a COBA member. Her daughter is in college now, but she does a wonderful job, and she we developed question and answers, and folks shared information each week. So I would encourage you to look at those as well. Week one, I did that one on the Worksite initiative. Then Kristen Arambula Hernandez did the week two on indigenous milk medicine. And then Melissa Kiana Pooney did the third week for Asian American, Native Hawaiian, Pacific Islander week. And then Jillian Whitaker Bray did the fourth week on Black Breastfeeding Week. So they all did a great job. So I'd encourage you to look at that as well. We also had the U.S. Department of Labor shared working mothers what to expect from your employer. And so that link is still available. And then the last one was with the U.S. Department of Labor. Jessica Parker is our Oklahoma U.S. Department of Labor representative, and she and I did that presentation for worksite breastfeeding support. And that one will be up later this month. We'll get it up at the end of the month. Okay, so that's just a few of the things that went on this last month. So if you will move on to the next one. And this is our breastfeeding friendly work sites. We actually have 380 currently recognized breastfeeding friendly work sites. And we recognize these in July and in January. And they are posted on our website, the Preparing for a Lifetime OSTH breastfeeding website. And we have a new URL. So if you're looking for us and haven't found that, here's the URL, oklahoma.gov/health/breastfeeding. And then it's if you'll go to working and breastfeeding and then resources for employers. And then it's also posted on the COBA website under breastfeeding at work and worksite recognition, and that'll be posted soon. And if you haven't noticed, COBA has a new website, and it's new and updated pictures and always great information. And finally, we have the breastfeeding logos I wanted to mention. This was a joint effort from numbers of people. Amanda started the process, and then we finished it up, and with Denitha in communications. So this is our new logo that I guess we had the old one for 10 years. So new logo, it's portraying gender neutral parents, one holding a breastfeeding baby with a supportive figure. And so we have them for use in a whole variety of areas, activities, promotions, with and without a circle. We have one with just the logo, with no wording, and then we have them in color and black and gray. So, and then I guess the next one, please. So upcoming events, the next work group meeting will be virtual teams, is scheduled for November the 17th, 10 to 11. And then coming up this next year, we have the Becoming Baby Friendly in Oklahoma Summit, and that'll be in March. And the date hasn't been nailed down yet, but check OBRC for more information. And there's the link. And then also WIC is going to hold the annual, we haven't been able to hold it for the last couple of years, but the annual state WIC nursing conference. And those dates are March 27th through 29th. Then we have contact information for Adriana, who is a work group co-chair, and also for Becky as well. And as Becky mentioned, I'm going to be retiring the end of this month, and I'm working to get everything done. So everything finalized. And so thank you, Becky, for your kind words. I've enjoyed working with you as well, and have learned so much from you and from everyone. And it's been a joy.
Thank you, Nancy. As you can see, while we're really going to miss her, she has 24 years of service, and she is the passionate advocate, one of the most caring people you will ever meet or know. And we are going to miss her greatly, but wish her all the best in her next journey, and ask her to stay in touch with us, please, because we'll miss her greatly. So thank you, Nancy, for all you do. And thank you to the Breastfeeding Work Group for all the great information and work that you've been doing. See that you've been very, very busy and just getting the word out and helping make things better. So thank you.
There is, Joyce, there's one question that's in the chat. It was for Becky. Are the child care centers working with the Go NAPSIS program and a PSACC program? Are you familiar?
I actually am not familiar with that, and maybe that's a question Nancy and I can ask of Peggy Byerly, who is, the health department person that kind of oversees childcare licensing and stuff, or childcare issues. So I don't know. Yeah, that's a great question. We were looking at, different avenues for, kind of reaching out to the childcare centers outside of the licensing, which is difficult to change. So.
Well, and Becky, we can talk a little more offline, but just so everybody knows, it's called Go Knapsack. It's through the University of North Carolina, and it's kind of an self-assessment program for childcare centers. It's that long acronym. It's something about nutrition and physical activity self-assessment for childcare centers or something along those lines. But breastfeeding is one of the best practices. It's really to try to help childcare centers to integrate kind of best practices around physical activity and nutrition. And so our cancer team has been working closely with one of our other community and analysis and linkages team on some of that. And so I think there could be some opportunity to, kind of look at that together.
Yeah, no, absolutely. So we can talk about that offline. The other thing we had discussed with Peggy too was looking at the, what is it, Nancy, QRIS? So it's kind of like a quality certification, not licensing, but so there would be maybe another avenue to incorporate some of that additional breastfeeding support for them. So.
Yeah, and I think part of Go Knapsack is working. That's one of their outcome goals too, is to help those centers to get that star rating.
Okay, perfect. All right.
Very good. Thank you. Okay, well, with all those wonderful work group updates, we'll move forward towards our closing. Additionally, these are other awarenesses going on besides infant mortality awareness. As you can see, those related items in relation to suicide prevention, sickle cell, and childhood obesity also have their awareness months this time. And then in October upcoming is Intimate Partner Violence, Newborn Screening Awareness Month, and SIDS and Safe Sleep. So there will be a lot more information coming out, a lot more promotional, getting those messages out in regard to safe sleep. I think there's a great opportunity to make a difference there, as well as several of these other related items. So again, it being Infant Mortality Awareness Month, please spread the messages, keep spreading them, liking them, getting out on social media, continuing to get them out in every avenue that we can so that we can make even more of a difference for our tiniest and vulnerable Oklahomans that we all see these wonderful pictures of and want to truly continue to make that positive difference. But I do want us to also, while there are many challenges and we continue to face those as we address infant mortality reduction in our state, I do want us to take time to celebrate what has been accomplished by each of you and the work that you're doing for these efforts. And nearly a 20% decrease, that's a great thing, great work. And let's keep it going. Let's keep that trend moving downward and consistently. So thank you all for all you do. Appreciate you. And let's continue to get that word out. Any announcements or final items does anybody else have that they would like to give before we close?
Joyce, this is Joni Bruce with OFN, and I'd just like to invite everyone on October the 11th. OFN will be celebrating their 25th year of serving families, and we're hosting an event at Chicken and Pickle. And I can send the flyer, Joyce, if you'd like to send that out.
Yes, please do, so we can get that out. Oklahoma Family Network has done amazing work in getting the family voice out in relation to preparing for a lifetime infant mortality reduction, and also our maternal and child health and behavioral health efforts. So yes, we want to celebrate that 25th anniversary, and happy 25.
Thank you. I appreciate it. It's been good.
And this is Heather. I put the link to the web information on our website in the chat, so you guys can just click on that if you want to know more.
Wonderful. Thank you, Heather. Anyone else? Okay. Well, we will go ahead and close, and we'll give you a few minutes back in your day. Thank you, everyone. Have a wonderful day.